Hey there, it's Lowell Wild Jr. This week, I have something I want to talk to you about, and it's have you considered how your patients feel when they're sitting in your treatment chair or when you are giving them instructions or recommendations about treatment? Here's why I'm bringing it up. Last week, my wife had to have a substantial dental procedure, and she went to the oral surgeon, and she went in there and she sat there and nobody really told her what was going to go on. Nobody told her, was the procedure going to hurt? Nobody told her, was there going to be pain afterwards and how to manage it? So she's in there, she's laying back, and the surgeon walks in and says, do you have any questions? Didn't explain the procedure, just said, do you have any questions? And she kind of did, but felt a little awkward and said no, which her fault. She should have maybe said yes. But the guy does the procedure. It's super painful to her. The shots are painful. He doesn't completely numb it when he's doing the procedure. And then afterwards, she has tremendous pain. They didn't give her any recommendations on pain control. They didn't tell her to take Advil. They didn't give her any pain medicine. They didn't tell her to ice it. And she was really uncomfortable. She's a physician, so she's a podiatrist, so she knew what to do on her own, but she still felt like it was disconcerting that nobody explained and nobody gave her any recommendations. And she said to me, we need to think, are we doing a better job? Are we doing a good enough job so that our patients understand what the procedure we're doing, whether it's in the office, whether it's in the surgery center, whether it's in the hospital, and what their post-operative care is going to look like. And I feel like I do a really good job, but I'm sure we could always do better. So the reason I'm sitting here right now in the treatment chair is how many of you have thought about what it feels like to be in a treatment chair and actually to look around and be a little bit nervous and what's going to happen with the procedure? I would encourage you to do that. I can tell you that I've had some procedures before that have been really intimidating, and I haven't felt really good about it. And so I try to put myself in the shoes, if you will, in the treatment chair of my patient or their family members, and I try to explain things to them on as basic and understandable level as I possibly can so that people can really start to plan appropriately, be prepared mentally, physically for what they're going to go through. And sometimes we're busy and we're in a rush and we really don't think as much about that, but you do. You need to slow down. You need to stop, take a breath, and think about what the person where I'm sitting may be thinking and appreciating. So as you look at your patient care going forward, and remember, FABI is all about patient care. There's the business aspects of things, but ultimately it comes down to patient care. I want you to really start to think about what your patients are considering and thinking when you're talking to them, when your team is talking about them, and the fear and the intimidation that they have, and making sure that you're doing everything that you possibly can to make that be as great of an experience as they possibly can have. Have a great week.